So tell us a story. Probably, the biggest story that you can tell us as far as biggest cost savings or time savings. I know you have a multitude of them, but what's the one that comes to mind first where you saved a patient ER visit and possibly thousands of dollars and a multitude of time?
Absolutely.
Yeah.
So there's a couple of conversations that come to mind, but let me think of or express a family that we care for, who now we care for them as a business because they realize what excellent care we are able to give and how this direct primary care model returns us to kind of this island of sanity in a sea of medical craziness, where it's very expensive and just fractured. We have this family that has a health issue. It's a genetic issue that runs through their family, and it creates this problem where their spleen gets large. They develop anemias as they grow their kids. They get these problems that are related to their gallbladder. They came to us just bouncing from doctor to doctor to doctor, and no one having the time to actually sit down and explain why is it that they're going through this. Secondly, they were frustrated because they were never quite getting to where they needed to go. And no physician that was actually taking the time to explore this unique genetic issue that they knew was in their family, and yet had some practical, real, ongoing issues that needed to have regular labs, needed to have regular visits, and then ultimately needed to find their way to the right specialist, not just any specialist who happened to be a network, but the right specialist. I took the time. Isn't that amazing? Time. Think about that. When is the last time you had time with your physician? But we had time to visit with them and hear them fully and hear the conversation. And then I had time to say, well, I haven't specifically cared for this genetic issue, but I'm going to spend some time getting to know it so well that I'll be your local expert for it. Through that, we then began and they had fabulous insurance, well, at least fabulous, let's use those words,
yeah,
insurance
right.
that would cover everything after you went through this crazy system of prior authorizations and denials and network referrals before you actually got to go to somebody. I took the time to actually call around our Northwest and to identify the physician that would be best for them. Not just any physician, not just any specialist, but the one that had actually cared for this condition and could guide them well through the process and get them the latest data. And thankfully, as a family physician who's been trained in the region that I work, I know these connections. And I actually have the time to develop them. So I picked up the phone for that specialist at Children's Hospital in Seattle, and I spent time with that physician on the time. I have time to do that because of our model. Our model, again, lowers the total number of patients. We don't have this huge amount of red tape and this requirement to push a lot of people through our practice. Instead, I can care well for a smaller number of people.
That's awesome.
Through that, we got those kids the care they needed. They got their spleen removed. They got the gallbladder surgery that they needed. They now no longer have anemias. I coach that kid in lacrosse and get to have him raise alongside my sons. I know the entire family, and now we get to care for their business because of the freedom that we now have to give that care.
Wow, that's definitely life-changing.
It has been, but they were in this frustrated spot where they had what they thought was good coverage, where they had access to all sorts of care, but no one to really actually take the time to walk them through it. They're mind blown because they realize for what they pay for us, which is $89 for their individual membership, they pay an extra $89 for the second person, they pay $35 for the kids. Their family is a family of 6, and I think they spend about $245 a month for their care with our clinic.
Wow.
There's no extra cost for their care. They pay labs through us at cost, which is 90% less than they would pay across the street at the hospital. 90% less, which makes those labs actually affordable and thoughtful. Yeah. They have the insurance, but most often what they say is, really? $50 for those labs? I'll just write a check right now.
Right.
I'd rather you just bill me. And then they now have taken their business, and he's a very successful businessman in our area, and has said, hey, we want to take this care because we know it's not just good care, not just cost thoughtful care, but it's actually changing how we are able to provide benefits to our employees.
That's powerful.
It is powerful, and it's one of the reasons we're at the Free Market Medical Association is to begin this network of people stepping out and creating this whole alternate medical approach that says it's not a bad thing for people to own their business, for particularly medical professionals to own the business, to be focused on excellence, which is driven by a free market approach. Not only excellence, but cost effectiveness, cost thoughtfulness. Physician, and you guys probably do this in your business. You don't do things that are a waste of time. You don't do things that are gonna be a silly use of money, because there's no bureaucratic aspect of it. You make the decisions that you know are best for the people that you care for. We apply that same thing to our business model, where we are very thoughtful about the care that we give.